the first female deputy governor of Rivers State from 2015 to 2023, a medical doctor by profession and a politician from Degema in Rivers State. She is the current senator representing Rivers West Senatorial District in the 10th National Assembly. I present to you Senator Ipalibo Banigo, Chair of the Senate Committee on Health. You're welcome to the program.
Thank you very much.
And I am Vivian Idekpefo, your anchor on this session of Standing Committees, coming at you from NTA Parliament. Now let's start from the very beginning. Tell us about yourself.
I am Senator Dr. Ipalibo Banigo, representing Rivers Senatorial West. I'm a medical doctor by profession, and I'm very happy to be with you on this program, NTA Parliament. Thank you for giving me an opportunity to talk about what I do as a senator representing the good people of Rivers Senatorial West.
You served as the first female deputy governor of your state, and now you are a legislator. How are you coping with transition, being you were on the executive side and now you are with the legislature?
Well, I have always had a life of service. Before I became the deputy governor of Rivers State, I had served Rivers State in various capacities as the Secretary to State Government, as the Head of Service, as Commissioner of Health, Permanent Secretary in the Ministry of Health, and going down to being even a principal of the School of Health Technology. Then it was Rivers and Bayelsa put together. So I have worked, and my life has been a life of service. So when I went into the position of Deputy Governor, I took it as an extra opportunity to be of service to my people, and I made sure I used the opportunity to the best of my ability. And when I was given the opportunity also to serve as a senator, I also see it as a service to my people and to the people of Nigeria, actually, and also as a ministry unto God, because in any place that I serve, I believe that that is a place of ministry. So I do it with all my heart and with a lot of passion. You will be asking me what is the difference between being the executive and being in the legislative arm. It is all a work in progress, and it is all a learning curve. So I believe that in life, changes will come, and you need to learn on them. But if your basic principle is service, then that is the underlying pin to everything that you do. So to me, it's a learning curve, yes, but at the same time, because I fix my eyes on the major thing, which is my heart's passion, to reach out to my people, to reach out to the people of Nigeria, and to serve humanity.
Okay, so I believe you're having a very smooth one being at the Senate right now. You are saddled with the responsibility of oversighting tertiary and secondary health institutions. Can you tell us what you have found? Because we see that you've been on a lot of oversight visits, you've had several investigative hearings, public hearings. What have been the major findings?
Well, the major findings are basically that our health sector has been and is in dire straits, and we need to do all we can to revamp it. We need to look for more resources for it. We need to improve stewardship as well as accountability across all the various sectors. Every person should be accountable for the results that we want to have. We need to be able to translate knowledge across the board, various tiers of government, communities, and so on. And also to ensure that we have intersectoral collaboration, because health is always multi-sectoral. It is affected and impacted by various sectors, various areas of the community, various social strata and sectors of the community. So it is very interesting. Well, it's not very different from what I expected. Basically, our health indices have not been as good as we wanted to be. And so we believe that if we can put our hands together and work well on these items that we have been itemizing in the 10th Senate, the health committees have met together and we're working on, we should be able to find that there is improvement, and that's what we're looking for. Towards the indices, our maternal rates are not what they should be. They are very, very poor. The infant mortality rates, child death rates, even the our length of lives, longevity, is impacted by these various factors. So it's very interesting working with, going on the oversights and listening to the public speaking about it in public hearings, what their own desires and what they would want to see in the health sector. It's very interesting. And then going back to the drawing board and working with all the various partners, the Federal Ministry of Health, Social Welfare, and all the other partners. It's a very interesting and challenging period. Yeah.
In talking about your findings, you mentioned the resources. I take it to be both human and funding. How does Nigeria get to have what is adequate for the populace and to improve our health indices?
Well, to start with, the percentage of our GDP that is being applied to the health sector is way below what it should be. There was an agreement, an Abuja declaration that said 15% of GDP should apply to health across board. But what we are getting is much less than 1/3 of that. But this year, in the 2024 budget, we know that we have been able to push it up a bit, but it is still not where it should be. So we are still looking for resources, mobilizing domestic resources, as well as our development partners. And really, one of the issues that has been impacting the health of many of our peoples, of our communities, is that the poor coverage of the national health insurance. It means that people, majority of them, a very high percentage of them, are actually paying for their health services out of pocket. And this is a way of actually pushing them into poverty. Because if they spend so much money on their health and it's out of pocket, and then they have to spend on food, and they have to, you find that their health care obviously will go down, will not be optimal. So we are looking at how to increase funding to the National Health Insurance Authority. We're looking for using the Vulnerable Group Fund, which has actually been in the National Health Act, which was assented in 2014, but it had never really been activated. For the first time in 2024 budget, we have activated that fund. The Vulnerable Group Fund is to provide funding to be sent through the National Health Insurance Authority to the state health insurance agencies to provide targeting actually health for mostly the under 5s, pregnant women, the elderly above 60, and the internally displaced persons, and people also with disabilities. So these are mostly the vulnerable people. So if we can catch them and ensure that their health service is covered by health insurance, then it will help a lot to increase the overall outlook of our health services. We also have the Basic Health Care Provision Fund, which is also in the Health Act, and which has been activated 1% of the Consolidated Reserve Revenue Fund, CRF. But what we have noticed is that this funding, which goes, part of it goes to the primary health centers through the National Health, Primary Health Care Agency, to the state health care bodies. we find that the process of them actually impacting the delivery of primary health care. Primary health care is the cornerstone of health care in any country. But the process of them actually impacting the improvement of primary health care services at the grassroots level, at the community level, at the primary health care centers, have not been quite as transparent as we would like it to be. So this is where we come in with bringing out accountability frameworks to make sure that these funds do reach their targets, do perform what they are supposed to perform, and everybody sees themselves as a part of the process towards getting these results, and it's not just, passing blame on, but that I myself at the Assembly, I see myself as being accountable to ensuring that the processes gets results. The people at the community also find themselves as part of the process. They own it and then they participate in it, so that overall we can impact the outlook positively of the health services and their indices in our country.
Well, that's a lot you have going on there, and we certainly hope that very soon we'll start seeing results.
Yeah.
You have been on Oversight, and just last week you were at the Calabar Teaching Hospital and Federal Neuropsychiatric Hospital also in Calabar. What were your findings?
Yes, that is why, you see, these effective oversights are very, very important. Part of our legislative work, and also we should attend to it, because it's different from them coming to see me and giving me their papers and reading to me or in a hall. But when I go there and I'm hands-on and seeing it myself, it's a whole lot of a different story. For instance, what I saw at the University of Calabar Teaching Hospital, I could not believe it. I saw that the hospital was so run down. The buildings were run down. They had a huge accident and emergency building, very nice building, but not completed. And they have a lot of roofing. That was one of the first foremost prime hospitals that were built, along the number of them like that were built as tertiary institutions across the country. But because they were left uncompleted for a long time, the roofs are leaking badly, the whole place is. But the good story is that you have a batch of health professionals. The CMD and his team, I must commend them, that in spite of the place looks so demoralizing, but they still keep on at it. They're still pushing and doing their best. They're trying to re-roof it in bits, and then they're trying to do painting in bits. They're trying to do this. They're trying to finish the accident and emergency unit in bits and all that. And that is an 860-bed hospital, and no attention has been put on it. And it's so I really felt that we have to do something about this hospital. It's not just waiting for them to get these envelope things that come. They're not enough to make the impact. This hospital needs a special intervention fund to be able to fulfill its purpose and deliver its services to the huge constituencies that they have around that university teaching hospital. Huge, and they are doing training, they are doing research, they are doing health services. It is huge, and nothing but a special intervention fund from the Federal Ministry of Health, from the federal government, from the president, will be able to address the problem of healthcare services, training and research, which is so necessary in that hospital. The Federal Neuropsychiatric Hospital was in a better state. I felt a bit more relaxed with that place, and I'm happy they are doing their work. But they are looking for an extension to another site, so that they can continue to expand on their services. And for that, we will support them, and we'll see how we can mobilize funds for that.
Okay, so before we got on set properly, we were talking and you mentioned you have 72 health institutions under your committee to oversight. I believe these 72 health institutions have areas of specialization. So I am wondering, why then do Nigerians spend so much leaving the country for medical care?
Right. These 72 health institutions are spread across the whole country. There are federal university teaching hospitals. There are federal medical centers. They are specialist hospitals for orthopedics, eye care, and in other areas. They're specialist hospitals. And that is why I and my committee decided that we must visit these places. This week, we are going towards the southwest end. We are going towards Lagos University Teaching Hospital, the National Orthopedic Hospital, the Federal Neuropsychiatric Hospital, and some other hospitals there. We're going across to Ibadan. And in that axis too, we also have University College Hospital Ibadan, which is my alma mater, the Obafemi Awolowo University Teaching Hospital in Ile-Ife, the Federal Neuropsychiatric Hospital in Aru, and we are still going in that axis. So my committee, because we go in as a team each time we make these oversights, we feel that the need to see these things hands-on, to be there, to appreciate why is it that with all this up there and our health professionals are still finding that they are not quite satisfied and they're having to leave the shores of Nigeria, and they're leaving it, they say it is for greener pastures, but to be honest with you, those pastures are not always as green. But actually our medical professionals, whether they be doctors, nurses, pharmacists, medical laboratory, they are very well trained. They are very resilient. And so we want to meet them at the places where they are working so that they can show us what is the problem. What is the need in these places? We don't just want to hear about it when you come and meet us in the offices in the Senate, at budget defense. We want to see them. We want to feel with you what you're feeling on ground. And where there's a place to encourage you, we want to encourage you. Where there's a place to intervene, we want to go back and do the intervention the best way we can so that we can make the difference. So that they will not find that the reason for them maybe leaving is that they don't have the right equipment to work with, or they don't have the buildings are dilapidated, or that the place is not conducive, and so on. So that's why we are going on these visits and making them very effective and very robust so that we can come back and meet the needs of our health workers and ensure that they are happy to stay in the places where they are and perform their duties to millions of Nigerians. And so the visits are very, very key to our legislative work and to ensuring that we can continue to keep them here in Nigeria doing work for our people in the health sector.
Yes, I was actually going to ask if there's anything your committee is doing to make sure or to encourage our health professionals to remain instead of moving out in droves as we have seen the trend in recent times. But you have said your committee is working on some things around that. Okay, so let me ask, since you've taken care of that of medical personnel leaving the country in droves, if the public is to expect any health-related bill that is different from what we have now, that is maybe something that from your visits you see that this is a bill that should be put forward for the good of the public?
One of the things that we have noticed is a huge problem, is the issue of power. I mean, power is a problem for Nigerians everywhere. But you can imagine a hospital that does not have 24-hour power supply. Energy is very key. And so we have a bill that's using the Electricity Act of 2022. We want to ask that all health institutions should have subsidies constantly so that it reduces their burden of electricity needs, because many of them, they spend almost all their IGR on electricity, on energy. And they need that energy, they need it for their theaters, they need it for There are laboratory investigations, they need it for treatment, or those treating for cancer, they need it for radiotherapy. In so many ways they need it. So we want to say that I think that is a bill that has never come up before, and it is meant to improve on the ability for our health professionals to deliver services in the various health institutions across our committees.
Okay, so let's do a self-assessment.
Yeah.
The 10th National Assembly is a year old already. Yes, so let me congratulate you, 1 year at the National Assembly. And from your assessment of the work done so far, what would you say you have, the 10th National Assembly has done that we as Nigerians are or should be proud of?
Well, I think the 10th National Assembly, which is very well chairmaned by our own very distinguished Senate President, who is the chairman of the Assembly and also the President of the Senate, His Excellency Senator Godswill Akpabio. One thing that I've noticed about this 10th National Assembly is that it is very cohesive. There is, the chairman has a way of holding everybody together. It allows all views to come in. It's very inclusive and it's very cohesive. And I also admire the way in which under his leadership, he works closely, not in a way to subvert the National Assembly, but in a way he works closely with the executive arm in a way to bring progress to Nigeria and bring progress to the policies for Nigerians that will give Nigerians a heads up. So that is what I've noticed. We are going to be 1 year on June 13th, but that there is this underlying tone of, please, let's work together, let's do it together, let's be one house, let's be one family, and this is one Nigeria. You know, we have, for the first time, we have in the National Assembly many more parties, different political parties than we have had in other assemblies. We have so many more parties there, all being represented, and so you think that it will be a house of clamor, you know, but no, it has been quite cohesive under the chairmanship. And I think under the chairmanship of the chairman of the National Assembly, I think that everybody there wants to work towards improving the the standard of living of Nigerians. Everybody is very thinks much about the security issues in Nigeria, and these bills are always being brought up on this. Motions have been brought up on this. We've had to invite the heads of security agencies, not once, not twice. We've had to invite the heads of the financial agencies, and so on. So there is a very good feeling of how the Nigerian people are outside the National Assembly. There is a very good thought for them to enable them improve the standard of their living in Nigeria and also improve security. And so that is what I would say that we have been able to achieve in the National Assembly.
So I guess congratulations are in order. Congratulations.
Thank you.
So the director is telling me our time is almost up, but I don't want to let you go without touching on the scenario playing out in your home state concerning the political, do I call it crisis now, in your home state between the sitting governor and the former governor, the minister of FCT. What are your comments?
Well, actually, I don't really want to talk about that. But that now that you have asked the question, I want to start by saying that we want peace and progress in Rivers State. Because without peace, we cannot, the people of Rivers State will not be able to enjoy the dividends of democracy. And I will not be happy to see my people to have the dividends of democracy elude them across the whole state. So this matter, which is being discussed, is actually, for me, the way I see it, is that It is a father and son matter. And for me, I will always stand on the side of peace. I stand on God's side. And I am praying and believing that God will touch the hearts of the father and the son so that they can come together and bring peace once again amongst themselves. I believe that the son himself can have a one-on-one conversation with his father, with the father, and the father too can accept the son and let them work together for the peace and progress of Rivers State.
Well, thank you so much for sharing your thoughts with us, distinguished.
Thank you very much.
We
for
have
having
been
me.
talking with the chair of the Senate Committee on Health, Senator Ipalibo Banigo. We thank you so much for making it to the program.
Thank you, viewers. Thank you.
And congratulations on all the good work you and your team are doing to make healthcare available and accessible to Nigerians irrespective of status.
Thank you. Thank you.
And that's it at this time. The program Standing Committees returns next week. On behalf of the production crew, I am Vivian Itekbefo. Enjoy the rest of our programs.